Hello and welcome. Thank you for your interest in this video. Let me introduce myself to you. My name is Andreas Tilch. I'm a homeopathic doctor in Freiburg, Germany. And I'm working in my own office since more than 30 years. And my teachers have been Jürgen Becker. He was my first teacher. I got to know homeopathy from him in 1984 when I was a medical student. And then later on, soon there was Rajan Shankaran in the beginning of the 90s when he came to Germany and to Freiburg, and I learned from him. And then later on, there was Massimo Mangialavori, George Vithulkas, Paul Herskew, Jeremy Scher, and other teachers. And since 2006, my main teacher was J.S. Shah from Mumbai, India. And he was also the one who brought the wisdom of Streptococcinum into my life. He was the first one who initiated me with that there is something very special about this remedy. So Jayesh is now my very dear friend. I'm very, very happy to have him in my life and very grateful for everything that he brought to me. My English is, I will look for my words very often, so please forgive me. I'll do my best to make myself understand. What you're going to see now is a recording of a Zoom conversation between the Australian homeopath Sarah Valentini and me about a new version of the homeopathic remedy Streptococcinum from a C5 trituration. And this remedy carries now my name. It is called Streptococcus pyogenes, in brackets, Tilch C5. It was John Morgan, the chief of Helios Pharmacy in Tunbridge Wells, England. He made this remedy because of my request from a C5 lactose trituration in June 2021. And this remedy is available at Helios Pharmacy in Tunbridge Wells, England. When you look into the shop of Helios, you type in you search for Tilch, my name, Tilch, and then you will find that remedy, Streptococcus pyogenes, in brackets, Tilch C5. And there are potencies available. They are very, very strange for you, probably. There are 10C, 4C, 220C, 1.3 M, 7.78 M, and 46.66 M. And why I have chosen these odd potencies, you will understand during the course of this Zoom conversation. There are also LM potencies available at Helios, but I have no experiences with them so far. But as far as I know, in USA or in English-speaking countries, using LM potencies is very familiar. I have no experiences with them, but you can give it a try and you can see how it goes. And we would be happy to have your responses and your feedbacks. In these last, I can say from now, it's around 8 years that I've started to work with Streptococcinum, and first with the old, not triturated version from Helios, and then since 2021 with the C5 triturated version. And overall, it's around 1,300 patients that I've treated with this remedy, and most of them very, very successfully. And from all this experience, at some point I understood I have to write a book about it because it was just too amazing what I saw in my office, in my clinic. The results were so positive, and so many patients got into very, very good states, and they became more healthy, and especially also their emotional state became a lot better. They became more clear, more serene, more happy in their life. They could, in some way, there was less stress, there was less frustration. Many things became also in their life experience very lightful, and a lot of even bliss could appear, and they were in very good states. And that was so amazing to me that I decided to write a book about my experiences. And this book is available, unfortunately, so far only in German. It is called, I can show you, Von der Urangst zur Verbundenheit. The title in German means, the German title means in English, From Primal Fear to Connectedness. So that's what this remedy does. It helps to overcome inner patterns of existential fear and of inner trauma states. And this can be released and somehow cleansed and washed out. And then automatically it converts into a into a sense of connectedness, into a sense of trust, into a sense of understanding each other better. And in this book is about 388 pages, so almost 400 pages. And in this book, I write a lot about the principles and the energy patterns of this remedy. And this remedy turned out to be a broad spectrum remedy for all kinds of diseases, and especially for disharmonious systems, which means also in families where there are disharmony and there's one problem child or more problem childs or one problem partner, or you have you are stressed with somebody around in your own system, with your boss or with your family or with parts of your body which give you stress, or some disease that gives you stress, and you look at it in an anxious and existentially threatened way. This is what Streptococcinum, especially the C5 triturated one, can be very helpful for. And this book was published in May 2022, and meanwhile it is very successful. We have sold already around 5,000 copies. And this book was read by a homeopath, German homeopath. Her name is Tina Metz. And she contacted me some months ago and said that this book is really amazing, and she wanted to. She is part of a school in USA. The school is Angelika Lemke's School of Intuitive Homeopathy, and she's a student. She's very proud to be a student of this wonderful school. And in this school, they are very close to treat children with a syndrome called PANDAS, or also PANS. This is a pediatric autoimmune disorder related to Streptococcus infections. And she was very, very willing to bring this wisdom or this knowledge about this remedy into English-speaking countries, especially to her school, and to help these children. So she tried her best to translate as much as she could to some parts of my book and to tell it to her colleagues. And then at some point, she said, okay, we have to find another solution. How can this book be translated, or how can we have English-speaking videos? And with the translation of the book, it's not yet, we cannot see when this is going to happen. But then Sarah Valentini, a senior homeopath from this school, she contacted me, and spontaneously I decided, okay, we will do a Zoom conversation, we will record it, and we will make available this conversation. So this is what you're going to see now. So thank you, Sarah, for being so interested, and for being okay that we share this video to this community or to anybody who wants to see it. So that's it. Thank you for your interest. I hope that you will enjoy this conversation between Sarah and me. Thank you so much.
Yes, so Tina wrote about the remedy, and it was the C5 trituration preparation. which I really want to talk to you about that. And immediately I've prescribed strep pyogenes quite a bit because I work with kids with PANS and PANDAS a lot,
Mm-hmm.
mainly, which PANS and PANDAS.
Yeah, maybe you can talk a little bit about this, because this is a diagnosis that is not very frequently, and it's not really known in Germany, in our area.
Oh,
So
yes,
I would be happy to understand myself
yes.
what do you see in these kids, and what were your experiences?
So PANDAS is pediatric onset. Actually, no, PANDAS is pediatric um, autoimmune neuropsychiatric disorder associated with Streptococcus.
Mm-hmm.
And so
Mm-hmm.
with these kids, we when they have a strep infection, we don't see the normal acute symptomatology. We see neuropsychiatric symptoms such
Mm-hmm.
as
Ah,
OCD, tics,
ah.
emotional ups and downs, severe anxiety.
Mm,
They'll often be urinary issues.
mm,
I mean, there's a whole kind of group of symptoms that you can really fit around. They can be rageful. They won't want to leave the house. They'll lose the ability to. Their handwriting will suddenly become really unclear as well, and they really struggle in school. So basically, like it's a neuroinflammation type of
mm,
picture.
mm.
And so
Oh.
often these kids aren't getting sick at all,
Mm,
and
mm,
often we'll see in the family history as well. That parents have had strep throat quite a bit, or had
mm.
tonsillitis, had have their tonsils removed.
Yeah.
Um, and that kind of thing. And then these kids, a trigger comes along, and suddenly they're in this state. And PANS is pediatric acute onset neuropsychiatric syndrome, which PANS actually relates to any pathogen and actually any allergen as well.
Mm,
So this can flip them into a neuroinflammation state and have the same similar kind of neuropsychiatric symptoms
mm.
too. So, yeah, so I'm working a lot with these kids, and a lot of them have a lot of different presentations.
Yeah.
But you can tell, the general kind of, they rarely get sick, and when they do, if they do, that it'll be more the kind of behavioural neuropsychiatric symptoms. Things
Mm,
like hand washing, rigid routines,
mm.
um, and that kind of stuff.
Yeah. Okay.
Yes.
Mm.
Yes.
So I
So,
have understood that pathology. Yeah. That
yes.
we see these kids here in Germany also, but
Yes.
so far it's not really in the consciousness of
Uh-huh.
medicine here that this is related to Streptococcus infections. It
Oh,
seems.
interesting.
It seems. Yeah. Yeah.
Ah. So
Yeah.
it's so interesting how, um, I guess that, because I mean, I'd love to hear about from your perspective as well, why you chose strep um, pyogenes
Yeah.
for
Mm.
remedy.
Yeah,
Yeah.
it comes from a completely different angle, and
Mhm,
it
mhm.
happens to be like a somehow a law of resonance that now this comes into your the group of people who work with this sort of problems. And of
Yes.
course, it makes completely sense that this remedy should be very helpful for these problems. But what I see it very helpful for is much more than this. It's just like it's like very broad acting remedies, just like almost like there are antibiotics that are helpful for many germs, and this is like a homeopathic remedy which is helpful for very many conditions. And these Streptococcus or Streptococcus pyogenes diseases or related diseases are some of them, and they react. The Streptococcinum that I work with, it seems to help. It helps very good also in acute tonsillitis or scarlatina or these things. I see these things quite often.
Mhm.
But in these cases, it's very interesting for me that you see such good results. But what I see is even much broader spectrum with people also who have never had any contact or not any known contact with Streptococcus. It's just like anybody who lives on this earth and is walking around. is
Right.
very is very it's very possible that he will have a good reaction with this remedy, because it's a very broad spectrum remedy. Yeah.
Yes, right. And the C5, I guess, representing miasm and the collective.
Yeah.
Um, is that why you chose C5? Because it represents
Yeah.
miasm? Yes.
Well,
Yeah.
with that, yeah, I can tell you a little bit the story of that. It was like in 8 years ago, my teacher Jay Shah from India, he comes to Germany used to come to Germany quite often. Now since Corona, he has stopped traveling. But before, he came twice a year to our city here, and in one seminar he talked about Streptococcinum as a remedy, which he saw in India as a very broad spectrum remedy for people who are very conscious about what is my immune system, is it working, and will it be able to overcome this infection. And people who have recurrent infections of upper airways, of sinusitis, of ears, of throat, of chest, of pharynx, and these areas, and they have recurrent these infections, and they are concerned, will I be able to overcome this? This was what he said, that where he saw this remedy working.
Oh,
And he said he was very amazed that there were also, he saw cases of he used to give it also in this with when there's this history of Streptococcus infections, and he gave it when he knew that, he used it like a nosode. But then after some time, he saw one really difficult case of heel pain with very aching heels, and like when this person could not walk, and this person didn't have any problems with throat infections or nothing. Then there was no Streptococcus history, nothing. But this pain was so bad, and he was treating this woman for 4 months or so, and nothing would help. And so he chose, for some reason, he didn't know why, he chose that Streptococcinum C200. And in a not triturated way. This was the former version of Helios. It was not triturated at all. And he chose that remedy to give to that patient, and like a miracle, after 4 days, her heel was completely fine, and she didn't have any more pain, and it just was gone forever. Yeah. And so he was quite astonished, and he told us about that this remedy is really very broad spectrum, and it can help so many conditions, and he doesn't understand it. And he said that one day maybe he will sit just like sitting there with a long beard and giving streptococcinum to everyone, and everybody would call him Strepto Baba. That was what he said.
love
And
that.
now, and then and then somehow, okay, was sounded very interesting, and so I got interested. Okay, interesting. So I ordered that remedy from Helios in C200 and 1M, and
Mhm.
I kept it in my office. And then 4 weeks later, there was one lady coming to my office with a very difficult situation of rheumatoid problems. She had a sarcoidosis of her lung, and she had like rheumatoid thing, very painful. She had a erythema nodosum, you call it. It's like autoimmune disease of the skin, of the legs, and they were just like big swollen areas, like reddish and bluish and purple, and very painful. And she was using a wheelchair at that time, because she was a young woman of 35 years or so, and this woman, I tried to treat her with normal, regular homeopathic remedies I gave her. She as a cause for this state was just before she had a very difficult situation with her former husband, ex-husband, and he accused her because she also had a daughter with a handicap, and he had accused this woman that she was guilty of the handicap of her daughter. And that was just like very, she took this very deeply as a inside, and it was just like enormous. She felt very misunderstood and just like accused wrongly, you could say. And then she was very bad in that state, and just a few days later she decided, okay, we will not I will go back to my normal state, and this next time when he does this, I will accuse him. And then a few days later, then this whole situation with this autoimmune disease started very acutely. So this was some history of suppressed anger and suppressed and a very strong anger, very strong feeling of blessed and accused in a wrong way and without reason. And then she developed that. And so instead of striking back against him and having a fight or whatever, she somehow took it inside and developed this autoimmune condition. And I at that moment, I didn't know, but my first idea was to give her Natremure as a remedy for just like that, taking in and being to bottle up this anger and this being hurt. And that Natremure didn't help very much. It was, I had given that remedy to that, this is also written in my book, I had given that remedy to that woman before, and it had helped to some extent, but not really like very good constitutional remedy, but still that was the best that I knew, and it didn't help her in that condition. And then at a later point, I tried APIS and also for some days, but it also didn't help. She had a dream of had a dream of bees in just like in a place where the bees live, and a mouse was coming from outside and tried to get into that bees area and to take away their resources. And I understood, okay, and she liked bees very much, and I thought, okay, this might be a case of APIS. I gave her APIS and nothing happened, nothing, it was just didn't work at all. And then I saw her already, okay, she will go to the hospital and they will give her these anti-rheumatic remedies and she will take, she had to take painkillers like twice, 3 times a day. And at night she woke up, she couldn't sleep. She was very in pain all the time. And then I gave that Streptococcinum 200, and her state cleared up completely. And it was just after 3 days that she could reduce her painkillers, and it went better and better and better. And then she could start to walk again. And this whole lung issue with that sarcoidosis and breathing problems disappeared and dissolved, and it just went away completely. And after half a year, there was another X-ray done, and nothing was left in the lungs, and all the changes that they had seen before had gone, and there's no more any rheumatoid problems at all. And so that was just like, somehow I understood, wow, this is incredible what that remedy can do. And I understood that I have to think of it more. And I thought still it's after strep infections that that if there's something, she had an angina before, and or several anginas, and also I was not very successful with homeopathic medicines. We had to give antibiotics sometimes. And now, after many years of experience with this remedy and all sorts of preparations, I know that what she had, this swallowed down anger, this swallowed out negativity in herself, this swallowed down negative feelings, and I want to shout it out, I want to just vomit it out, I want to beat him, I want to insult him, I want to whatever, but there's a lot of negativity and swallowed down energies. And when that is not coming out and you feel like to suppress it, you have to, because when you think, if I let it out, I will make my situation worse. Yeah, that will make me, it will aggravate the state that I am. When I let it out, everybody will, I will be ashamed, I will be attacked more. And that is like the Streptococcinum general issue. It's about feeling accused wrongly, and you have to swallow down your negative emotions, because when you let them out, you will get antibiotics even more. Yeah, that's
Yeah.
yeah. So
Yeah.
that's, they need to somehow compromise. This was just like this germs on the on our in our mucous membranes. They need to be to keep very silent, to be very calm. When they start to make symptoms, everybody will just say, well, go away, we give you antibiotics, just like dirt. This is not going to be there at all. We have to suffocate it right from the beginning. We have to kill it straight away, and this is not valued at all. It's just like germs that you don't want to have in your system at all. They are not allowed. They are just disgusted, neglected, thrown away. Nobody wants them. Nobody would give any value to a handful of pus from Streptococcus mucus. Yeah, nobody would say, "Oh, please give it to me. I will
Yeah.
put it in my nose. I will try to incubate them in my system." Yeah, this is just like the most disgusting substance. You want just to throw it away and not have it. Yeah,
Yeah.
and that's the inner feeling. That's the inner feeling after all these experiences with that remedy. Is just like I'm afraid of anything in me that is just like disgusting, that is just like not valued, is just like unworthy. It shouldn't be there. There's something in myself which is just like not okay. Yeah, and when this is when this is seen by somebody outside, or I'm afraid to show it, so I need to be very, very charming, very nice, very, very, very. I need to adapt to situations, and I need to be very, very helpful to other persons, because when they see like my other side, my shadow self, I have to suppress my shadow self. That's somehow the inner theme of many Streptococcinum people. And then when you see, and then there's the other side also, the very rebellious side. That then after, when this is the one side, the very bright, very shiny, very charming, very friendly, very soft people. You would say this is just an angel, fantastic. They're so social, so helpful to anyone. Yeah, this is just one side. And these people, that when they get really aggressive diseases, that just like the throat infection comes, and it's very bad, and they suffer a lot from the aggressivity of any disease. Yeah, then the feeling is, okay, this should go away. I don't want that. These germs, they have to be killed. I want to be nice and shiny, and not angry and weeping, and I want to be a social. I want to be a valuable social part of society, and this unsocial germs that come into me, they need to be killed. Yeah, don't want them. Yeah, so there's just like this disruption of very, very bright side and a dark side. So that's the dark side is very not pleasant. It's like a monster. You're afraid of monsters. You're afraid of dangers. You're just afraid of people attacking you. You see all the dark things outside, and you yourself, you try to be like holy and very, very nice. Yeah, and
Yes. And that kind of, describes, I guess, the compensated state of
yeah, that's it.
streptococcinum
Yeah,
is the shiny one, and the
yeah,
uncompensated, which is what we see in pandas,
yeah, that's it.
is that really dark side. And
Yeah.
yeah, yeah,
Yeah, so that's
really
about the
shadow.
idea. And the pandas thing, that all these obsessive and the autistic things, and this you let anything out. This is just like when you see, I don't know what your experience is in families, but when I see families with some problematic children, whatever the problem is, then you can always see somehow this split. Then there's our family is just very nice and friendly, and we do everything to be valuable part of society. But we have this child, and this is a bad problem, and this he is just like not he shouldn't be like this. We try everything to make him social, but he will not understand. He is not understanding. He is rebellious. He's just like the Streptococcus in the system. He's a somebody that you cannot just disinfect him.
Yeah.
but it's just like you feel like, okay, I'm ashamed of my child. I don't want to how can you be like this? How can you I'm so social, and this guy is, my child is so unsocial. It doesn't fit into society. Is rebellious. It's not listening to people. It's not learning. It's just refusing anything to learn, and it's just like giving only problems. And that split is very, very typical for Streptococcinum. And then in order to heal that, you need to give this remedy to all the family. It's not only to give it to the children, because the children, they somehow are just like this dark energy, the shadow energy has to go somewhere. Yeah, and when it is inside, you bottle it in yourself. Yeah, then of course, then it goes into some pathology in you. Yeah, then it goes into very bad throat infection. It goes into very bad stomach problems. Goes into very bad infections of anything. It can go into diarrhea. It can go into very aggressive bowel problems, into kidney problems, go into cancer. It can go into anything. And then it also, and then it can also go into your child. It can, and you have in your child, you see this negative side, like a big thing, and there it is, and you cannot just ignore it. It is there. And in one way, you could say that this child has that problem in order to confront you with your own shadow side.
Yes, absolutely.
Yeah.
And this, I think I've seen that in family units, and actually, I have a number of families that I want to give it to, but there is that situation, very clearly where, and actually one family who I did give the remedy to, and this child I'd already given strep pyogenes to. She has PANDAS, and it was okay. Strep pyogenes, it did some things, but it wasn't amazing.
Yeah.
She had other remedies that have been very good, but recently she had a big flare, and this big flare she hasn't had a flare for years like this. And I said, okay, we're going to give her this. We're going to give her the Strep Tilch remedy.
Yeah.
And within 20 minutes, she was out of the flare.
Wow.
Within 20 minutes. Yeah.
What does it
and her
mean,
mum
flare?
wrote to me and
Tell me,
said,
what is that flare? What is flare? What does that mean?
no, flare is like in pandas, like sometimes when there's when there's an exposure to the strep or to whatever the pathogen is, the behaviors just increase.
Okay.
So this girl mostly, I've been seeing her for 3 years, and she's actually she's very good. A few little things have been creeping in. But she's doing really well. But recently, for some reason, we don't know, suddenly, and I feel like perhaps strep was in the field. Maybe she came in contact with it. So yeah, but I gave her that remedy. So her behaviors increased, and she was having big meltdowns. She wouldn't listen. She was in front, like in public, she would just be crying and, throwing herself around. And she had some sensory things, like she wouldn't wear underpants. And she was also, one of the big symptoms that we see in these PANDAS children is urinary issues. So when they go to the toilet to pass urine, they always feel wet afterwards. So they wipe and wipe and wipe and wipe and wipe because they're feeling wet all the time. So it's quite common. Like parents will say they go through so much toilet paper, and I'll be like, well, that's this particular symptom that's associated with PANDAS.
Yeah.
So all of that exacerbated in her, and she took the first dose of the remedy, 40C, and 20 minutes later, just fine.
Yeah.
Fine.
Fantastic.
Yeah.
Yeah.
Yeah. So, and I had given her.
Yeah. There you can see that's the difference between this not triturated or not enough triturated remedy and the triturated one, and that came later to me. And then I because I also had made this experience with this regular from Helios, this 200C, which is I found out it was not triturated at all. It was just like from the a basic substance. It was just like diluted and potentized with water and alcohol, but there was no trituration done. And with that remedy, you can see like sometimes good results, mainly on an emotional level and on a mental level. You see that people see things differently. They feel some relief. They feel like that there are amazing results also that I have seen, because this encouraged me to continue with that remedy. But then at some point you see it's not working as deeply as it should. It's just not going too deep into the tissue of the body. It's somehow not physical enough. It's just like it gives you many dreams. You see many dreams of your shadow self. You see dreams of monsters. You see people shooting you. You have all sorts of things happen in the dream. But in the tissue, in the body, just like this release is not so much, you cannot see it so well. You can see it in an emotional and in the dream level and this, and you see also somehow in the physical level also, because otherwise this heel problem would not have healed in Jay's case. Yeah, there, of course, it works on the physical level, but it's as I would describe it as this trituration thing. I would describe when you have a tree. Yeah, this tree has roots, and this tree has just like how we in Germany would call it Krone. Is it crown? Is it the what would you call it?
Branches
The
and
branches, yeah,
leaves.
the whole upper part of the body of the tree, yeah. And so what the not triturated Streptococcus pyogenes does, it just like it helps the upper part of the plant of the tree. Yeah? It is just like make this. It tries to make that bigger, or to flower this, or to open it to a more bigger space. And but it is not very good for the root. So for the root you need the trituration, and these 5 triturations, because it is a very collective issue. I chose to give this was Witold Erler's idea. He founded that C4 homeopathy together with my teacher Jürgen Becker. And they said that we need 5 triturations for very collective issues. And so I asked John Morgan from Helios that, and he prepared it again from the same substance like the old Streptococcinum. And he ordered that substance again. It's just sterilized, lyophilized Streptococcus pyogenes. And he did these 5 hours of trituration. For me, I felt very honored. And then he said, okay, which potencies do you want? And then I also followed Witold's formula, because there's one formula, and it says there's a formula of 6 times 1 is 6, plus 4 is 10. So C10 would be like the first optimum potency. 6 times 2 is 36, plus 4 is 40. So this would be like the second maximum of good energy. And then the third one is 6 square 3 is 6 times 6 times 6 is 216, plus 4 is 220. And then this is formally, and then I followed that formula, and then there's 1,300 is next step, and then 7,780 is the next step, and then we have 46,660, which is also 6 times 6 times 6 times 6 times 6. It's 6 times yeah, plus 4 is then that. Yeah. And so with that, with that, these potencies I chose because I followed just Witold's ideas. Yeah. And now I work with these potencies and this new Streptococcinum, and John Morgan, he decided to give that remedy my name because I ordered it. So I said, well, there's so many people who have contributed to that remedy that it should be called like John Morgan. It should be Jay Shah's name should be in it. Witold Ehrler's name should be in it. Jürgen Becker's name should be in it, but it would be a horrible long name. So we just know, okay, we call it Tilch. That's it.
Yeah.
And since then, I'm
Yeah. I
proud
mean,
that there's a remedy that carries my name. But otherwise, I don't have any interest. I don't earn anything when it is sold or something. It's just like Helios. So it's
yeah.
nothing to do with me economically, but it's just like a question of honor. But
Yes.
yeah, and
Yeah.
with that remedy, you can see now that the root of the body, the physical part, is also very much nourished, and you see like it's like an anchor. You get more anchored inside yourself. You get more solid ground under your feet. It's more bringing you into a stable. You're stable inside yourself. You feel like more connected to the earth. It's just very incarnating substance. You get really familiar with the earth, with your body. You feel some more at home in your body and on that, in the place where you are. And then on the same time, you depending on the potency in the other direction, when you go very high, then you will see an enormous widening of your consciousness, and you see a lot of simultaneous things happening, and just like network things happening for you, and many things happening in a just wonderful network way. And in the same time, physical symptoms go away. And this works best when you treat the whole system, when you don't only treat that symptomatic part, which could be the child, but when you treat like the whole system that it lives in.
Yes. Yes. Definitely. And I think that, I was saying about my son before.
Yeah. Tell me, please.
So he doesn't have a diagnosis of PANS, but definitely he could fit into that kind of category. And
Mm,
we moved house in December, and since then he's been incredibly emotionally up and down. He has a lot of fears. That's mainly his presentation,
yeah.
um, and sometimes kind of some repetitive behaviors or some OCD. I have to touch this 4 times, kind of thing.
Mm, mm,
Anyway, I was giving him lots of remedies that have helped. I gave him strep pyogenes. I gave him 30. I gave him 200. I gave him 1M. I'm pretty sure I gave him 10M,
yeah.
and nothing,
Yeah.
nothing was changing it, and it was really starting to, be very difficult. And then in January, my husband became unwell and ended up in hospital with
Oh.
pneumonia, strep
Mm,
pneumonia,
Strep pneumonia.
strep pneumonia,
Yeah.
and and so and then he got out of hospital, and my son's behavior was still bad. And then I thought, I think my husband is the strep carrier
Hmm.
in in our house. Actually, I think because he's had this like kind of funny throat thing, and a few other things going on. And then I read Tina had written about this remedy, and immediately I felt like I need to get this remedy. I really want to try it on my family.
Hmm.
And so I got it, and I gave it to my son, and the 40C, because I didn't have the 10C. I don't think was available at
Yeah.
Helios when I
Yeah.
bought it.
Yeah. Hmm.
It's more recent, but also within 20 minutes, half an hour, different kid.
Yeah.
Like, just I was just like, oh, thank goodness, because he was becoming so difficult to deal with, and every time we would go somewhere, he'd have a meltdown, or
Hmm.
and anxiety and all of those things. And so
Hmm.
it was quite impressive, actually. So I was
Yeah.
very excited, and I really feel I have a the I don't there's a so in the School of Intuitive Homeopathy. So I'm one of the teachers, but Angelica Lemke
Yeah.
is she started the school originally, but then we kind of made it a bigger thing. But she also has a dispensary in the US. I have a lot of
Hmm.
clients in the US, so they've just ordered it there, and there's going to be. I want to try it on a lot of families over there, actually,
Yeah.
because
Good
I think
idea.
I feel very good about how much it's going to help these families.
Hmm.
Um, yeah, and the other thing I wanted to mention to you, because when I kind of thought about this and I saw the amazing effect that it had And I was thinking, why aren't all the nosodes, the miasmatic nosodes, made in C5, like
Yeah,
from
yeah,
C5?
yeah, of course.
I feel like they should be.
They should be, but you know,
Yeah.
somehow this Streptococcus is somehow like a joker miasm. It's just like a miasm that it includes so many miasms, and
Right.
it's somehow like a, when you since I have that nosode, I almost don't use any other nosodes because it's just like so it's just like a polycrest of
Yes.
miasms. Because
Yes.
when you see this in the Streptococcus infections, you have that pus, which in a lot in inflammation and pus coming out, and you see a lot of mucus, a lot of pus, just like this is like very much like psychosis. And then you have issues of the skin. You have just like little infections of the skin, which are more like in a sorer state. And then you have the very syphilitic states also. It can go to very bad situations of life and death, and you can feel it's just like very dangerous. And then you have also this malaria miasm. It's going away, and then it comes and it goes again. And then you have the cancer miasm. You have that we need to control it, and we need to make it perfect, and we need to get everything out, and we need perfection. And you have just like so many miasms are combined in that. And so
Mhm.
somehow I feel like you can, it's just, and what it does when you give that remedy to just like anyone, what it does is that it stops like circles of always going back to the same to again to frustration. It's just like whatever you do, you try and it doesn't help. Whatever you do, you try that and you do that and do that, and you think, oh, it's going to be better, but then again relapse and things are getting worse again. And this,
Yes.
in whichever situation that is, that could be on a physical level, just like I try to get rid of this skin problem, try to get rid of my belly problem. I have this bloated belly, and it just doesn't go away. And whatever I do, it's always getting worse. And you give that remedy, and some solution will turn up. It's not only that when sometimes it's directly you give like you saw in your son, you give that remedy and you see straight away it's a different kid. But sometimes you see also, okay, you give the remedy, you don't see straight away is it helping or not, but in sometime later something occurs that is very helpful, and that helps really on a on the long run. This could be
Yes.
like you see an osteopath, or you go to a psychotherapist, or you go to some sort of healing, or even some operation is done, or even some antibiotic is given, or whatever is done. But somehow you find a way out. It's just like it opens up, just like it brings things into movement, and it opens a door for a way out. Sometimes you can see straight away that this remedy is opening the door and you are out, but sometimes you see that you don't see it directly, but when you look at it 4 weeks later, you see some movement has happened and a way out has opened. And you try to you think, what was the last thing that I did, and then you connect it to this last thing that you did, and you forget that, okay, you 4 weeks before you gave the Streptococcinum 40C, but in fact that remedy opened up for the inner space for a really good solution.
Yes.
and
Yes.
and this is because that remedy has a very, very strong relationship to the way that we are born on this planet. It's just like
Mhm.
when we come onto Earth, we just start like this one single cell, yeah, and this one single cell is just like uh, somewhere in the body of a woman with who is like the host, yeah. She's like a host organism. Sorry,
Mhm.
and I need to stop that. and and how does it feel there? How is it there? And then and the incarnation starts, and you feel, and you somehow you are in that belly of that woman, and you don't know, where am I? I have a body, and and it's somehow getting narrow, and it can be nice. It can be nice and cozy, and it can be very scary, and whatever and you feel like different feelings in the womb of the mother, and you feel like, am I okay, or am I not okay? Am I liked, or am I not liked? Will I be valuable when I come out? Will they love me, or will they say, okay, this is rubbish, it goes to the garden, and we will not take care of it. So this anxiety, am I okay or am I not okay? And then you have that birth experience, which is very scary experience, can that be? And then you have like a trauma, you cannot move, you cannot do anything, and you are just like in a horrible state. You feel like choked, and you don't know what's happening. All my resources are taken away. And this is very close to that angina feeling of the Streptococcus, which makes like, okay, I'm choked, and I'm not allowed to breathe anymore. They take away all my resources, and this is like a trauma. And when you come out, you are happy. Okay, this I have overcome this, but I don't want that. This should never happen again to me. I will avoid to be choked again. I will avoid to again be in a state of threatened to death. Yeah, and so then you start behaving and try to be a pleasure for your host family where you live. You need to be nice. You need to adapt. You suppress your negative aspects. You suppress the things that are not valued in the family. You suppress maybe tears. You suppress anger. You suppress disgust. You just whatever you suppress, and then you start to get symptoms, and this all this suppressed thing goes into symptoms, and this is very much connected to feelings during incarnation, before incarnation, during incarnation, during pregnancy. What is the relation that you feel connected to your mother? Or you felt like during birth, do you feel like, okay, there's someone with me, I'll be fine, I'm happy, it's fine? Or is there somebody who says, okay, I don't want to have this anymore, this child shouldn't be there? Whatever this negative feelings, and then all this will reflect in your life experience, and this is where the Streptococcus is very, very close to that is why it is helping also people who don't have strep infections, because there's, by the law of similars, it's very close to our just direct experience, common experience that we have in the time of the belly in our womb, in the womb of our mother. Yeah.
Oh, aha. Actually, yes, because Tina mentioned something about um, she actually translated a document
Mm-hmm.
and showed
Yeah.
us, like it was from one of your papers, and I read it and I was like, there's a lot here, and I guess it was like, how would I differentiate this with another remedy? And she mentioned about, yes, like she's not sure also differentiating it from the matrodonal remedies,
Yeah.
for
Yeah.
example. And I
Yeah.
wasn't sure why she brought up the matrodonal remedies, but now you're explaining that,
Yeah.
I understand.
My
Um,
feeling is all these matrimonial remedies that you talk about, I've worked with them very much, as a and just a homeopath for 30 years, and I've worked for such a long time, just like everybody does, every homeopath, and very classical homeopath. I've been very unicist and all that, yeah. And I've worked with many lack remedies, and I've seen people going along. I have seen good results to some extent with luck humanum. I've seen good results with luck caninum, with luck felinum, with all these things, and I know that these remedy can help also very much. I have also in my book I have written about one woman, 29 years I have given her luck caninum, and it was it always helped her out of panic attacks for 29 years. She was well with that remedy, and I thought once it was found, she was always getting out of these panic attacks. Wonderful. But still, again, she had these relapses. She came again into it, and this was already C4 triturated leccaninum. Yeah, So, and very good remedy, but it always somehow she remained in the same level of difficult situation with which this panics would always come back, and this and with her relationship there was a lot of violence and a lot of disgusting things happening, very low level of communication it's to some extent, and feeling like dogs barking at each other in some way, you could say. And this remained after for 3 decades. Yeah. And then
Yeah.
and then at some point I thought, okay, we have to give her that Streptococcus, and then I gave her the old one, Streptococcinum Tilch, and the effect was almost just like nothing. Yeah, it was just like And I came back to Lecaninum, and I thought, okay, this remedy is not going to help her. And then at some point I had these 5 C5 triturated ones, and I gave her from that point on, she's reacting beautifully on this C5 triturated streptococcinum, a lot better than at any time of Lecaninum. And you see now beautiful changes happening in her family, and there's a very good new constellation happening. And at some point she said, okay, I will separate from my husband. He has to go out of my house. And then she put him out of the house, just like, I will take care of myself. I'm now dare to say no to him, and you go out of my house. And he went out of her house, and she was more in peace, and she took care of her borders much more than ever she had done with this Lecaninum. Lecaninum was good to some extent, but it didn't change her personality somehow. And she was not daring to say really no to that person. She was always giving in and never trying to open her, not daring to open her mouth, always saying, okay, wait, did he need to talk at some point? But I need to find the right moment when it's just before Christmas. No, now I don't want to say something, because then we will have a bad mood, and I need to be careful, and never the right moment would come then that she would dare to say no to that person. But now with that 40C stop, and then he really moved out of her house, and she said, okay, we have to divorce. But then this man, he was somehow getting softer and nicer, and after there was some process happening between them. And now they found a good solution, that he is going to some place in the house she again allows him to come into the house, to some apartment that she has. And so they can be in a very helpful way, with the right distance and the right closeness. And so that's now she's finding this whole system is running in a much better way. And also her daughters and her grandchildren, they take that remedy as a family, and a very, very good, this whole system is developing in a very beautiful way. I would say that all these matrimonial remedies, they are very good in some way, but it's a shadow compared to what this streptococcinum can do for systems. Yeah, it's just this. I use I don't use these lac remedies very much in my office right now. Sometimes I've taken lacumanum, just like last week. I took it for myself just to understand how I feel with it, because everybody talks in our group, somehow they talk about lacumanum as a remedy for people who have a lack of nourishment or something. And my feeling is that it does something, but it's not, somehow it's more used in an allopathic way. When somebody has a lack of milk and you say, okay, we have to give you the milk now in a potentized form, it's just like, this is more like allopathy. You give it as a remedy to fill up a gap or something, and it's not the law of similars. So my feeling is, in this way, it never worked for me, this lacumanum, and also for me it didn't work in that way very much. After 3 days I decided, okay, I will go back to my Streptococcus. myself.
And what about the remedies like placenta, umbilicus,
Yeah.
vernix, amniotic fluid, like those matrodonal?
Yeah, they will probably. I have no really, to be honest, I don't have experiences. At placenta, we prepared one of our own child, and we produced that remedy, and we gave it to that child, and somehow I didn't observe so much. I was maybe I didn't follow it. My experience with it are very low. And but what I would say is that that all these are all like aspects of birth, and it's just like one
Yes.
little aspect, and this Streptococcinum is just like the whole story of it. It's just like a more um, I don't see you anymore. Are you still there?
Yes,
No,
I'm here.
no, I can see you.
Yeah.
Your video was somehow stopped. Yeah, I wasn't.
Oh,
Yeah,
okay.
it's just like I don't know, but this is just like, and then it's also infectious. You know, there's this thing of infection and fear, and there's existential fear in it. And when you have, and so, and in our experience on Earth, existential fear is a very big issue. And nourishment, of course, is an issue, and this umbilicus or something is also connected to this incarnation process. But this existential fear of being incarnated, this is much more similar to the Streptococcus than to umbilical cord, I would say. In the umbilical cord is just like human experience. It's just like something human, and it's more like isopathy. It's something from human that can heal humans, and of course it can work beautifully also. But when you want to have a remedy, just like from the big ocean of the similars, then I would say this is more isopathy, and Streptococcus is similarity.
Yes, I see.
Yeah,
Yeah.
that's what I would say about it. Yeah.
Yes. And when did you first make the remedy, or when did they first make it in at
They made
Helios?
it. They made it in. It was about 3 years that I worked with that old remedy very much. I used it in many patients from about summer 2018, just like mid of 2018 to June 2018 to end of 2020. That until that time I worked a lot with the old remedy, and I saw about 1,000 patients and 1,000 many family members, and I saw what this can do. And then in the end of and then that I received the first C5 triturated remedies was middle of 2021. So this is now almost 2 years. Yeah.
Okay.
And since then I've treated maybe again like 900 or even now up to 1,000 patients with this new C triturations, and it's very helpful for families and for systems. And you have to when you give it regularly to repeat it sometimes to all the members of the family, then you will see very good development in families. I can talk a lot about that.
Yes,
We
and
can
that's
talk
what.
about, yeah, I can talk about
Yeah, that's where I
one
see
more
the
hour about that. Yeah. What would you like to share?
I know, yeah. I can see that because in the families where the child has pandas, like
Mm-hmm.
there is that kind of, actually one of my patients, the one where I was telling you, the little girl who had her flare, and I gave her this remedy, and it
Mm.
shifted within 20 minutes. It was last year, the mother said to me, I think in a meditation, she said, I feel like we need to change our family's relationship to strep,
Yeah.
because I feel like it's affected her and her husband. Both had strep throat a lot as kids, and then they've got both their kids have
Mm.
pandas. She said, I need to change our relationship to it,
Mm.
because we see it as the enemy,
Mm.
and I feel like that also creates
Yeah.
keeps creating this pathology, because
Mm.
we haven't found our peace with this.
Yeah.
And that's why I did the strep pyogenes. I did 30C, 200C, 1M, and 10M with the whole family,
Yeah.
and it shifted some things. It did, but
Mm. Mm.
it didn't do everything. So I'm
Yeah.
quite excited to see for them,
Yeah.
that family, to
Yeah.
move through all these
Yeah.
programs.
And that's that issue with the enemy is very important. That's why I would say what umbilical cord is no issue with enemy. It's just like an issue of connected. In this aspect of connected is there. Placenta is also no issue with enemy. And in lacumanum, there's also no issue with enemy. It's just like I need some more of information or some nourishment or something that is there. But this whole enemy thing, this whole that there's something in me which is my enemy. So I need to avoid that an enemy comes into me. That's what we saw in the corona pandemic, that everybody was just like very, very careful that this enemy shouldn't come into me. And this enemy could be for the one, it was the virus. This virus is the enemy and needs to be fought. It needs to be cut down. It needs to be completely eliminated. And for the other one, it's the vaccination is the enemy. When I get vaccinated, the enemy, I will be destroyed by that enemy. So everybody has fear to whatever enemy, you don't want it in your side, in yourself, because it will destroy you. And that is but this is only a reflection of the inner enemy that everybody has inside, which is like some unwanted inner child, some unwanted inner negativity, some unwanted inner monster, this unwanted inner very angry part, which wants to rebel and wants to break out and wants to be very antisocial and wants to be completely selfish and wants to just to shout and hit and hurt and kill and destroy. And this side, when it is not valued, that it is also allowed, that then a child can be very, very very angry against his parents, and they will not stop, judge it and throw it out of the relationship if they say, okay, well, do you feel better now after this tantrum? You feel fine? Come here, my little child, I'm fine, and we are still connected. It's very good that you let all this out. Nobody, usually you're not brought up in that way, because it's just like, this is suppressed. You need to be nice, say I'm sorry, go to your brother and bow down and tell him I'm sorry, I will never do it again. And so this part of you becomes your own inner enemy, and everybody outside who brings this inner enemy to the surface is your enemy also. So
yes, right.
So this is this whole enemy issue, and that's why the Streptococcus is much more powerful than these lack remedies. These lack remedies have also that enemy energy in themselves, in their own social societies. Like the dogs, they have this enemy, and the cats have this enemy, and they all have this enemy consciousness inside them. But of course, the humans have this enemy consciousness inside them, and so the products from humans will also be helpful in this part, because it's some enemy resonance is also there, but it is just like much more elaborated and far away from the source. The source is just like this bacteria, this small bacteria, which is not wanted, and this is just like the root. It's just much more the root than everything else. Is just like branches. The cats are branches of that, and the snakes are branches, and the scorpions are branches, and all these wild animals are branches. And you can also lions and tigers and all that, and spiders and all that. But when this energy that is the problem in tigers and in snakes and in scorpions and everything, you all find that in the Streptococcus. It's just like the remedy that connects all these enemy and toxins and all these whatever the enemy outside is.
Yes, right. That's so interesting. I mean, often when I've prescribed strep pyogenes before, I prescribe it. I feel like it helps to change that person's immune system towards strep. Like I feel like it's reshaping that relationship. And I'll often give another constitutional remedy as well, because I feel like supporting those two things at the same time. Do you ever work like that, or you just would give the strep?
I
Amazing.
use other remedies also when I need them. And sometimes they are needed, but in many cases they are very rarely needed. And I have many cases in families they only take strep in different potencies since years, and they're going very well. And then from time to time you see somebody, then you need to look for, okay, some acute is there and it's not resolving only with that potency. So I give some like Hipasalve or some Myristica or some snake remedy or something. But usually what I do more is when I see difficult cases that don't get well with the Streptococcinum, what I do is I give it to other parts of the family also, because when you are too close to, you see only that child, and and you also have to treat the other part of the umbilical cord also. It's just when you have a child that is afraid of going to the kindergarten, of separating, the streptococcinum will help very much in many cases. But this anxiety of separating from the mother, because all these enemies outside, and here this is my safe place, and outside there's all full of enemies, so I will cling to my mother. But when the mother is still very anxious and has inner enemies and has a fear, oh, my child, when its child goes there, and how will it be there, and I don't like this kindergarten teacher, and she's somehow an enemy for me, then this child will not go there
Yeah.
and be happy playing, because if the mother feels there are enemies outside, please stay with me. Or if she feels even I'm anxious without you, I need to cling to you, because who am I without you? Now I've been a mother and all this time, and now you develop and you start becoming independent. You don't need me anymore. Who will I be? And I will be left like, who am I? Am I still valuable or not? Am I still somebody who is valued, and how about all that sadness that is in me, inside me? Can I weep that out? Who will take me in my arm when my child is no longer with me? My husband is always in my work, and I'll be lost alone and just with all these enemy feelings inside me. And so I prefer that this child remains with me and is not courageous and goes to that place. Yeah. So you need to always treat both parts, especially mother and child is very important. And when you have a child that is not doing well with, if you give him that remedy, instead of giving a different constitutional remedy to this child, it's, from in my experience, is a lot better to give the same Streptococcus remedy to the mother, and maybe to the mother's mother also. I see very good cases of 3 generations taking that remedy. The whole system becomes a lot more alive and a lot more happy and a lot more developing, and you see things moving, and you see development, you see flourishing, you see many good things happening in the whole family when you have all the generations included.
Ah, amazing.
Yeah,
Yes, that kind of ancestral
yeah,
piece, like, because sometimes, we can work with the child and then the mum will become unwell
yeah,
because we've
yeah,
alleviated it, pushed back. I've seen that,
yeah,
happen so many times actually. And
yeah,
yeah, it's this is really interesting. But I'm also curious, like, compared to other pathogens like Staphylococcus,
yeah,
um, like, why did you choose strep? Like, I mean, I know why that you learned from
yeah,
Jayesh and all
Jayesh,
the
yeah.
things, but
Well, the
are you curious about
yeah,
Staphylococcus? Are you curious
yeah.
about other?
Well, when you look at Staphylococcus, it's just not so much that enemy issue. Yeah, it is just, it is on the surface of the skin. You can live with it. It's just it's doing pimples. Okay, you have pimples in your face. You do some disinfection, but nobody will be afraid of staph mucus so much. Yeah, you will not fear to death when you have a staph infection. You will not fear that your heart can be damaged, that your kidneys can be damaged, that you can get an autoimmune PANDAS disease or something. Okay, there are some cases where you can really have a bad sepsis or something, but in the general human consciousness, this is not the enemy. It's just like something that you live with, and many other germs are there, and you are happy with them. They can be there or not, and you don't care so much about them. And then also the staph doesn't have this issue with birth. It has that, not that my throat is I'm choked and I'm choked to death is not the issue of staph.
Yes.
So this is somehow a more and also Jayesh, he has worked a lot with other germs, other bacteria, and he wrote in the foreword of my book, he wrote that he had done a lot of research also with other bacteria remedies, but he had never seen such a broad spectrum response as in strep. Yeah. Maybe
Yes.
at another point you could think of tuberculosis or something that was also very, very common. But also tuberculinum is not so much in everybody's brain. It's not so much a no-so of day-to-day life. It's just like, but this strep is just in every kindergarten, in every school, in every family, and it just goes to everyone. It's just like so broad and nobody wants it. And it's just general, complete agreement. Whenever they are there, you don't want them. Yeah, you hope that your body eliminates them on themselves, or you kill them with antibiotics, but you don't want to have them. You're not happy to have them again in you don't want to nourish them. Yeah.
Yes.
And so that's the issue of our inner fear, that if we show our shadow sides, whatever is there, we are going no longer to be nourished. Our resources will be taken away. We'll be thrown out of our organism that we are dependent on. And that is
Yes.
very much that streptococcinum energy.
Yes. Right.
Does that make
Yes.
sense to you?
Absolutely. Absolutely. Yeah, it's
Mm.
incredibly fascinating, and I'm so grateful for you explaining this to me.
Yeah.
Because I've always thought that, and when I started working with pandas kids, that they actually, especially if it's strep that they're affected by, um, it's showing us the remedy. Actually, it's showing us the energy
Mm.
of that
Yeah.
that
Yeah.
bacteria. Like
Yeah.
we're getting to see our materia medica right there, and
Yeah.
it's really interesting because actually it's a really common symptom with pandas kids as well. This fear of choking or fear of vomiting and choking.
Yeah.
That's a
Yeah.
big thing that comes
Very
up a lot.
strong. Yeah, you can see very good results with people with stomach pain and fear of choking, fear of vomiting, and they try to keep it inside. And fear of vomiting would be like, I would love to vomit, but when I bring it out, it will deteriorate. It will aggravate my symptoms. I will be judged. I will be thrown out of the system. And so they try to keep it inside. And then they have belly problems and they have all sorts of problems because this negative energy is not allowed to come out, because
Yeah,
it is not a negative energy. It's just like a rebellious energy. It's like a antisocial energy. It's like I want to live energy. It's like I want to be myself energy. I want to express myself energy. I want to be the way I am energy. It's just like I want to be okay the way I am, whatever I do. I want to be loved unconditionally. That's it.
yeah,
In the end,
yeah,
yeah. And
yeah,
I have to. But when you live the experiences, when you let that side out, you're no longer loved unconditionally. You are thrown out of the system. That's the
yeah.
Streptococcus experience.
Yes,
Mhm.
yes, amazing. Um, yeah, it's really exciting, and it's really. I mean, I really hope that your book can be
Yeah,
translated to
yeah, I
English.
hope so. Well, what we're
Yeah.
going to plan is that we are my very nice colleague from Germany, Gabi Schörk. Maybe you've heard her name also. She's a we made we developed a course in German, which is a 9 or 10 hour course of videos, and I presented a lot of cases and a lot of is where you see where will all what I told to you already will explain it more. And this course we are planning to translate into English.
Oh,
or we're
fantastic.
we're trying to see if this is possible and to make it available so that also people from English speaking countries could somehow get a license for that course, and then have a just like a seminar where many aspects of the remedy are explained in a better way, and so you will be able to work really by better understanding with that remedy. And so that's the next thing that we're going to plan. And
Okay.
so anybody who's interested to see if that could be helpful, then we try to make it available also in English. You could ask maybe your colleagues if they would be interested in a course like that. Then
I
we
think
would go for it. Yeah.
yes, oh, many, because we have lots of students, a lot in the USA, some in Australia,
Mm.
some in the UK. We have and Tina's obviously in Germany,
Yeah.
so we have students all over, and I think everybody's quite interested,
Yeah.
and we're quite interested actually. We're really interested to hear
Super.
about.
Yeah. So
Yeah.
I'm really happy that you work with that remedy. And it's for me, it's when I was 16 years old, I was in Australia, in Melbourne, for 6 weeks, and I enjoyed
Uh-huh.
that country very much. And since then I have not returned. And I
Uh-huh.
have some still one or two friends in Australia, but my it's too long ago that I've been there. And
Uh-huh.
where do you live in Australia?
I'm just outside of Melbourne.
Outside of Melbourne. Wonderful.
Yeah.
Yeah. So this is
Yeah.
somehow my return to Melbourne.
Yes. Yes.
Yeah,
Amazing.
yeah.
And yes, I I am presenting at a conference later this year. I think I told you, and I'm presenting some information about strep.
Hmm.
It's so when I heard about this remedy, and I thought I have to try it, and then it was amazing, and then so that's why I reached out to you. So I was wondering if I have any more kind of questions or need any kind of pieces put together.
Yeah,
Are you okay for me to email you just in case I'm kind of going, I need some
yeah. Very good.
words?
Yeah,
Yeah.
the streptococcinum is a network remedy. It's just like for systems working together. And it's just
Mm.
like that this is like in our body, we have everything is fine. We want to have everything in harmony, but then there's this one organ which is not working the way it should, and we want to get that symptom to go away. Yeah. And this is just like whenever you have somebody who has some problem, he says, I want to go that away, then this is very, very likely that Streptococcus will help him, because this enemy energy, you don't want it. Yeah. This
Yes.
unwanted energy that expresses in some way in your physical body, there will
Yes.
be some shift, and some shift in the way you look at it. You will understand why it is there, what is the message inside this, in that. And many of this will heal in sleep, and will somehow you will sleep deeper, and then somehow you will look at this whole thing differently, and you
Mm.
will, this enemy aspect will go away. You will see there's something, and there's a message for you. And also, in your child has a message for you, your pandas child has a message for you. You should just like when the child has a very monstrous appearance, then you should just look more inside your own inner monster and try to bring your own monster a little bit more out. Yeah. When the people in the family, when they take, in the pandas family, when they take 40C, they will be more clear, more uh, free to express, to be themselves without thinking, oh, will I aggravate my situation when I say this, what it needs to be said? They will just say it, and they will be more clear, and they will vomit out what needs to be vomited out. And at this, in the same time, the child can relax. Yeah, this is no more need to show the parents their shadow self. So,
Yes.
so this is like a whole healing of the whole
Yes.
system, and that's what you see in pandas, but you see it also in just like any difficult child. You see it in any difficult disease, any difficult thing that you want to go away. And when you learn from each other, then and this network thing, then your former enemy becomes your friend, and it becomes like your your divine helper in your own spiritual development.
Yes, yes, yes. And that's why I think it's going to be amazing for these families.
Yes.
So, yeah,
Yeah.
I will keep you posted. I'd love to kind of tell you about some of the family because I plan on, especially I've got a number of families in the USA that I want to
Mm.
I want to give to the whole family
Yeah,
because they're quite stuck.
yeah.
And yeah,
A
yeah.
good way to start could be just like to repeat a 40C. What I start usually is I tell a family, take a 40C once a day for 2 weeks. And it will when it feels good, you continue with that for 4 weeks. And when everybody, and then what happens is that at some point, some acute comes up at one or the other way. And when this acute symptoms come up, somebody goes into a state of helplessness or something, some old symptoms come up, some throat pains come up, whatever comes up. What is then needed is just like a space of being completely safe and held. And it's just like you're just like a children's disease, just like when you have scarlatina, you go to bed and you need the experience that you are in a safe place and there's somebody with you who takes care of you and gives you who comforts you and who gives you unconditional love. And then you can, in such a case, you repeat that 40C even more. You give it 2 times, 3 times, 4 times, 5 times, 7 times a day. You can give it in a water diluted. You repeat it more often. And then you stay, and the mother also, and she takes off her work and stays with the child for some time. And then what happens is a sort of bonding. It's just like, okay, it's just like the child, it just like it fills up with unconditional love. And that makes it very courageous. Then after some time, there's a turning point, and then it gets better again. And then you will see a big development, and the child will do other things that it didn't do before. It will be more courageous, will dare to go out, to reach further out, and to be itself in a very adventurous way somehow. It will be not scared of enemies. It will be more adventurous in seeing what will happen. I'm happy to see some things that I'm outside of my comfort zone somehow. And it will not fear everywhere many enemies. Yeah, it will be more open to develop in a free way on this planet. And then families, they can, and sometimes the other child will get sick, 2 or 3 children will get sick. Some time of sickness might be there for some time, but this is just like after all this time of anxiety and insecurity, this is needed to somehow ground yourself, to make the experience that you are really welcome on this planet. And then from there, this is what makes the root growing. Yeah. And in this fever state, all that, the nourishment that comes, all the love that comes from the parents goes very deep inside the system, and it overrides just the old enemy program, and you get a new program of trust and adventure. Yeah. And you start to love life, and you start to love the things you could try out, and you start to try to be yourself. And that's what you see when you continue with that remedy. And I recommend to repeat it once a week. Every Sunday, all the family, they take a 40C, and when they've done that for some time, 3 months or so, you could also change to the next potency, 220C. That potency is sometimes one, which is also sometimes for some people fantastic potency. Some have a lot of emotional issues coming up with the 220C, and for them it's, when you go to the next level, to the 1.3M, it's easier again in the 1.3M, and then you go later to the 7.78M, and then you become very clear. And many things develop in a very nice way in families, and you get, and the 46,660 is also a very nice potency, but I would not recommend to start with that one, because it will confront you in a very, it's just like enormous between a very, very high tree and a very, very strong trunk. It's just like big thing. Yeah. And I would it wants a lot when you take that potency. It really, it's just like Herausforderung. What is the English word? It's just like, yes, it's a big thing to deal with that. And I would recommend you start with lower potencies. 10C is also very nice. You could start with 10C. It was not listed in Helios, but now it is. And Yeah, but I recommend to stick with that remedy, not to just leave it away. Something it's just because it does some sort of cleaning up your own system, and this cleaning, it's just like a cleaning woman that comes once a week. It's very good that she comes again and again and again, and it's, if she doesn't come, after some time your house will be a mess again. So you need somebody, some cleaning, and some things that have been swallowed down, they need to be brought out, because otherwise swallowing down will to some extent begin again, and then you will have more problems again. Somebody will start swallowing down things, and then problems will get worse. So better you give that potency just regularly, and after some first time of bonding and getting more trust, then things will become very clean, and you will have a very amazing life experience.
Aha, fantastic.
Yeah.
I'm very excited about that. Yeah.
Yeah. Okay.
Yeah. Yeah.
Thank you.
Thank
Thank
you
you so
so
much.
much.
There are a few things that I would like to add before we end this video. If you are a homeopath and you think about starting to treat patients with Streptococcinum Tilch from C5 trituration, there are usually two things that I would strongly recommend to you. First thing would be, please read my book. It's full of very useful information, and you will have like a map of many things that could happen during these processes of that are facilitated by Streptococcinum, and you will get like an idea of what could happen in various cases, and how this healing mechanism works. But as this book is not available in English so far, and we don't know when, so I will try to give you some more information, some more additional information in these last minutes of this video. So, and the second thing that I would recommend, if you can't read the book, please look the video to the end. Maybe you will get some more clues. But there's one thing that you can do, and this is before you start treating patients with that remedy, start treating yourself with that remedy. And don't take it only once or twice, but go a little bit with it. And you could take it like in 40C for 1 or 2 weeks. You could take it on a daily basis, or you could take it 1 or 2 or 3 times. And you could go with it like for 2 weeks or 4 weeks on a daily basis, or even twice a day. All this is possible. And you could also give it to your family and to your system that you live in. And then you will see, sometimes you don't feel so much inside yourself. You take this 40C and you might feel, well, I don't, there's nothing that I can see in happening in me, but you might see something happening in your family and your brothers and sisters and your wife and in your children. And they might observe something in you which you are not aware of. And so when you have a whole system that that changes, then it will be easier for you to communicate and to share your observations. And this will give you a very good clue. When, we have said that streptococcinum is a remedy for disharmonious symbiotic systems. And you will see things happening in your family, but when you are a homeopath, there's a very good chance that you will have a strong resonance with that remedy, because as homeopaths, we also are like Streptococcus bacteria in the healthcare system. Somehow tolerated but not really appreciated, and from some people even, like, they say homeopathy should be abolished and should be thrown out of the healthcare system, and homeopaths, they are treating with nothing, they have no value at all, and they should just get lost and should not be there. And this kind of, we try to do our very best to understand our patients and to heal them, but we are not, there's a lot of frustration because the health system doesn't want us, or the feeling of threat that we might be disinfected, like Streptococcus bacteria thrown out, just like dirt thrown out of the system. And this could threaten our resources and our way of living, and how can we earn our living if we cannot be in the system anymore. All this is triggered, and homeopaths will feel that a lot. Other doctors, like conventional doctors, also have a very, very strong tendency to react to this remedy, because they are completely all the time thinking about infections and about germs, and what can we do to avoid this, and what needs to be done to throw out this, and how can you get rid of that disease. So the whole health system, if you are a homeopath or a conventional doctor, will be very, very most of these people who work there will have a very good resonance with this Streptococcinum. And when you, as homeopaths, you take this remedy, you will somehow, it will help you to lose this, to terminate this subscription of frustration, this subscription of stress, this subscription of not being valued, and of trying the best of despair, of recovery. You try to the best, and also for your patients you try and you look for this remedy and that, but somehow there's always a relapse, and you try your best, but you can't really help people sometimes. And one remedy seems to help for 1 or 2 or 3 or 5 times, but then next time there's a relapse again, and you have to start again thinking, and what can you do? And this sort of struggle will be terminated when you start with this Streptococcinum. And also when you have a feeling inside yourself what it does for you, and also when you see you treat patients with it and you understand the principles of it, then you will have a lot more fun in your office, and many difficult cases will ease out. That's what happened in my office after so many years of treating as a conventional unicist homeopath, which I still am. But the only thing is that now I have this one joker remedy with what I can really like ease out so many difficult cases. It's not this is the only remedy that I give. If I have a wonderful constitutional remedy, of course, and if you have one, please give it, and if it works, wonderful. But in all these difficult cases where you just try this and try that, there the Streptococcinum will most probably bring very wonderful solutions. So this is something that you should do. And when you have started with 40C, you could later on go to 220C and take this for like 1 or 2 weeks. And then you could go on to 1.3 M and finally to 7.78 M. You could just like do this 2 weeks first potency, 2 weeks second, 2 weeks third, and then 2 weeks 7.78 M. That would be a good possibility to see what it does to you. But you will understand yourself. Very important is you shouldn't follow a rule. You just what the remedy helps you is to listen to your intuition and to the signs of your body. That's what it helps very, very clearly, that you see when you feel, oh, today I don't want to take it. If I feel it's like too much, I don't want it today, you just don't take it, and you just leave it away for some time. And when you feel like, okay, today again, I feel like attracted, I want to take it, follow your intuition. And also to your patients whom you recommend it, tell them not to follow a strict rule to take it even when they don't like it. They should only take it when they feel, okay, I like to take it. And yeah. So there's one more thing that is very important, because we have talked in the conversation with Sarah, we have talked about miasms, and we have forgotten one very, very important miasm. And this is the most important miasm of Streptococcinum. This is the acute miasm. Because when you get scarlatina or a Streptococcus infection, this is usually something very acute. It's a children's disease with very acute onset. All of a sudden, out of the blue, from somewhere, it comes like a hit. It hits you. All of a sudden you start shivering, and your fever goes up like anything, and you have a very high temperature, and your head starts paining, and your throat is like choking feeling and choking sensation, and you feel like, oh, I cannot swallow anymore. And how about drinking? A very important resource of water, I cannot swallow it. I cannot eat. So what will happen if my nutrition is not there? So you're threatened immediately. And then it can go to a point where it's even difficult to breathe, and you feel like suffocated, and you have so strong pain, and it's all of a sudden you are in a state of really in danger, and you feel like completely acutely threatened. And so that is also part, and a very important part of Streptococcinum. This is like very acute belladonna states, you could say. And belladonna is a state, is a good remedy for these states. So we give belladonna for Streptococcus infection. So belladonna-like states must be part of this remedy picture. So then what happens? You get this acute disease, and then the one thing is, okay, will I survive that? What needs to be done in order to survive that, to get the fever down and all this? And then there's the fear of chronic disease that can develop from Streptococcus infections, like kidney problems. You could have chronic inflammation of the kidneys, or your heart valves could get infected somehow, and you could have a heart disease later on, or rheumatic pains in your joints. You could be a chronic disease, and you get all sorts of problems that remain after Streptococcus infection. So it goes from acute miasm to chronic miasm. And now when you give Streptococcinum to patients, or when you take it yourself, what happens is that it goes in the other direction. It goes from chronic disease to acute disease. So this means that during the course of this, when this remedy is working well, you will see that chronic diseases ease out, and they have less intensity, or they are less problematic, or you find there are solutions for that, or they just go away. Like allergies or asthma or other things, they can go away. But or even Parkinson's disease, it will not just go away, but there will be found good solutions for that, and you will somehow see some things ameliorating. But in the course of ameliorating this chronic thing, what will come up will be acute states. And as you know, this Streptococcus, they can do really acute crisis. That's the nature of it. So what will happen we talked about this in the talk with Sarah also. At any given point, some acute will come up. And the first acute thing that can come up is just like you feel tired. You feel like, oh my God, I have no energy anymore. I need to lie down. I'm so tired. I have no energy. Please let me lie down. And you could, if you feel like that, it would be good to take a day off or so. Yeah, if the energy goes away, don't drink just more coffee, but listen to the signs of your body, and tell your patients to listen to the signs of their body. And when they feel the energy is going down, they should follow this impulse and take time for themselves, and then sleep a lot. And you can see some very, very good sleep and very long sleep. And sometimes you see in a state of dreams, you see like changes happening in your dreams that some difficult or nightmares, they occur again, but for the first time they have a new solution, a better solution. Or sometimes the changes happen in very, very deep sleep state where you are not there, your consciousness is not there at all, but somehow in this very deep sleep, some things are resolved and repaired and your inner state changes. But also in your waking state, you could feel that tiredness and you feel like I need to lie down. But then also at some point, usually some infection comes, acute crisis as an infection. This can be very mild, it can be very, very modest. And when your body says, okay, I lie down, I need to take some rest, please do so. Don't take anti-inflammatories and continue to work, but take some days off and try to sleep and take time for yourself, and then continue to repeat this remedy and this potency that you had, or you could even increase the potency. You can take it 3 or 4 or 5 times a day, or you could stir it in water and repeat it very often, or increase the potency and also give it to other members of the family. That would also help. And then this acute will be like a bridge to more health, because when this acute is gone, the chronic problem is also better. You will see that some shift has happened. Sometimes you don't see anything happening until some acute comes, and after the acute, some skin disease or some allergy or some asthma or something eases out or becomes better. It needs this acute to come out in order to heal. So this is just like best homeopathy. This is what you can read in the organon, that these acute diseases, they are sometimes needed for healing, for profound healing. There could also be vomiting or diarrhea or it's very important. Also, these stomach problems are very important in Streptococcinum, or bowel problems, digestion problems. And when there's vomiting and diarrhea and things come out, this is like a cleansing process, and it's very good when this happens. And then you also accompany that with higher potencies, or same potency more frequently repeated, and then you will see that usually you can accompany that just with the same remedy. And if the crisis is really so bad that repeating this remedy is not enough, you are always welcome to add other homeopathic remedies, or if you are in contact with a homeopath, it's good to ask him, well, how can this crisis be helped? And if you don't have any help and streptococcinum is not helping, you could also use conventional medicine to stop that. It's also better than dying, of course. Yeah, you need some help in this moment. It's also fine to go to a hospital or to see a doctor, or whatever is needed. Something is needed to give you trust that this crisis can be solved. So these acute diseases, they are very important, and they are sometimes they can be really sudden onset, all of a sudden. And then what is also important is that you get into a state of somehow you cannot solve your own problems anymore. You need help. So you look for somebody who is there and who will take care of you, who will comfort you, who will be there for you, and who will bring you some warm water, some tea, some food, who will take care of you just like a child would, with 40 degrees Celsius of fever and scarlatina. And in this state of acute disease, the feelings will come up. Swallowed down feelings from before will come up, and sometimes it could be like fear and anxiety coming up. And it's very good to share this, to talk about this to somebody that you like. And you could tell your patients also. It's very good to call you and to let these feelings out. And it's very important to just feel them and to be with it, and to also at the same time see and feel that you are in a safe place, and that you are somehow you can feel that anxiety that comes up. It's a very old anxiety from before birth, or from during birth, or from incarnation. It's very, very old, but it's very good when it comes up, and you just are in a state where you can confront yourself with that feeling, and when you are in a safe space where you can just be with that. So that's also very, very important. And then sometimes the acute crisis can also be like a psychic crisis. You could have like very, very intense anxiety coming up also. This happens also from time to time. That one patient says, I was born as a cesarean section, and this feeling that I get now from 40C is just like a complete shock, and I don't know where am I, and I feel completely unsafe all of a sudden. And then it's very good to be with that patient and to talk with her, and to see what will help. You could increase also the potency. Just last week, one patient was there with that sort of crisis, and then the 1.3 M was very good to help her in that crisis. Sometimes in these acute psychic disorders, the lower potencies are not enough. You need 1.3 M or 7.78 M, and you need a lot of bonding. And even if you need some psychiatric aid or something, it's also fine. It's important, but that doesn't mean that the remedy is bad or something. It just means that something has come out and some solution is needed to be with that. And you just continue from time to time, or later on, you repeat that remedy again. And after all this has come out, things will become a lot easier. It's just like after this acute infections, when they have gone, even if they take some time, it might take 2 weeks, 3 weeks, 4 weeks before the acute has left you. I've seen cases like that. But you take your time, and like in a corona state or something, COVID-19, this can take quite some time, but you stick to that remedy, and after that, you will see things ease out. So the whole disease or acute crisis becomes like a good experience. It's like a bonding experience, and it creates trust. And you have a feeling of connection, and you feel more stable on the earth, and you have a feeling that my immune system has made it, or even if it hasn't made it, there was somebody outside who helped me, and I can trust into life on earth. And then it's very important in this whole thing that you really listen to the signs of the body and to the voice of your heart, and that you also give a voice to your heart, that it can be heard, that other people, that you tell them what you feel. It's just also sometimes you need to change your way of living. So you change your things that you do regularly, and you might feel what is good for you and what is not good for you, and you just throw out things and behaviors that are don't feel like nourishing for you, and you throw them out, and you find other things that are better. And so that's about it, what I wanted to tell you. These acutes, they can happen, and be aware that this can be there, and yeah, but don't lose trust into this remedy when you see these acute crises. This is part of the story. The acute crisis is needed to overcome chronic problems. So this is about it, what I wanted to share with you. I hope that you have enjoyed this video, and please share it. Share the email address where you can receive this link. And we are happy. I'm really happy that you have followed this video so long, and thank you for your interest. And I wish you all the best with Streptococcinum, and I hope that it will help you and your families and your patients. Bye-bye.